I'm Dr. Anbari at Studio Smiles, and today we're going to talk about dental veneers. I want this to serve as the ultimate guide if you're thinking about getting dental veneers done. Today we're going to talk about who dental veneers are for, the process of them, the different types of veneers, the cost factors that could go into getting veneers, and common questions that we hear about them. So veneers are typically porcelain that will cover your teeth in different cases. Typically it could be just for aesthetics. A lot of times it could be function for aesthetics. We just always want to make sure that we're focusing on the function before the aesthetics. So anybody could be a candidate for veneers. You just need to get an evaluation done, make sure that veneers are the right route for you, because sometimes it could be a mixture of different things to get you to the ultimate goal you're trying to get to. So there are porcelain veneers and composite veneers. Porcelain veneers are made by the lab typically, which will cover the entire tooth after the preparations are done or no preparations are done. Again, it varies case by case. Composite veneers are a composite bonding that is done in the chair, where we add in increments composite layering to get the teeth to the goal that we're trying to get them to. Now the difference between the two is that the porcelain, again, is made in the lab and the composite is made in the chair. The porcelain is less likely to stain with time. Composite is more likely to get staining and is more likely to be needed to be replaced sooner than the porcelain would be, which porcelain sometimes could last you maybe 10 years or longer. So teeth whitening can solve the problem of like a darker shade of teeth. It can whiten your teeth, but it won't change the shape. Another thing with teeth whitening is that it's only going to last a certain amount of time. Eventually your teeth can stain again. When you get porcelain veneers done, they last longer and the shape of your teeth can be adjusted to the way we want it to be. We get to pick what color we want to do, and it will be a walk-in, walk-out kind of process. When you do whitening, you'll come in, get your teeth whitened, and we'll send you home with some whitening trays. You might have to do that for a little bit longer, although you are typically going 1 to 2 shades whiter with a whitening appointment, whereas we have a wider variety of shades to choose from when we're doing porcelain veneers. When doing composite or porcelain veneers, porcelain tends to be the better route only because it seems to be more sturdy and less likely to chip than the composite, although it is still a possibility. The process is somewhat easier. You have more of a range of how you want to shape things. Everything could be planned from beginning to end. Digitally, we can shape things with a smile design and decide how we want to get you to the ultimate goal that you're trying to reach. Veneers aren't just for cosmetic purposes, they're also for functional purposes too. We'll do sometimes like a full mouth rehab where we need to get veneers in the back teeth as well to get more accurate bite, or crowns or whatever it is, to adjust your bite to get to the function that we want you to be at in order to achieve the aesthetic that you want to achieve as well. So if you're looking to get dental veneers done, typically you'd come in for your first appointment. We do like data collection. We'll get some x-rays, we'll get some models, some scans, take some photos. We'll make sure we have all the information we need to know where you're starting. And then we'll get a smile design put together to see where we want you to be. We got to make sure everything's clean. We need a clean foundation to work on. We're going to get rid of any cavities you have. If you have any super extensive cavities that are going into your nerves or anything like that, if you need any root canals done, we'll make sure that's taken care of, or any infections that need to be taken care of. If you're missing any teeth, we're going to see if we need to get some implants placed to get that in order to make sure you have a full bite. But we're going to get your data collection together, typically the first visit, get everything cleaned up at your next following visits, and then once we have a clean foundation, we can start working on the porcelain veneers to get you to the ultimate goal that we're both going to try to achieve together. So when we go through the smile design process, we're going to have some photos, we're going to get like some drawings where we're going to choose the shape of the teeth. We're also going to give you a selection of shades to choose from, different models for you to look at, see, okay, I want it to look sort of like this. Although we may get into the selection process a little bit, we'll get a little bit more involved to make sure that things are fitting and suiting correctly to your face, because everybody has a different style that might suit their face. The procedure is typically done under local anesthesia. We'll make sure you're nice and numb, you're not feeling any part of the procedure. You may get some post-operative sensitivity sometimes. We are kind of removing some tooth structure when you're preparing the teeth for the veneers. On certain cases, a little bit more in some areas, more than other areas. It really varies, but you'll leave with some temporary veneers. We'll make sure that you're happy with them, functioning with them. You'll wear them for quite a while, maybe 2 weeks to a month or so. Make sure you're comfortable. If you're happy with that, then we can have the final veneers ordered with the color that you choose and any size adjustments that you want to make, any shape adjustments you want to make, or anything like that. So we'll make sure you're happy with the mock-up smile first, the practice run, kind of the temporaries, and then you can come back in and we'll get things going with the finals. So when we're preparing things for either veneers or crowns, or if we're getting like a full smile rehab put together, or a Hollywood smile, or whatever you want to call it, we are possibly removing some tooth structure from some teeth. Maybe we're not removing any tooth structure from some teeth at all. Some teeth might need a little more tooth structure to be removed for us to get to the final goal of where we want you to function and how we want you to look. The goal is to be as conservative as possible. We want to try to keep as much natural tooth structure as we can, because that's where the foundation or the strength of the tooth really comes from. So the process can take a while depending on how we want to approach things. If we're going to go for like an arch at a time, or are we going to do the whole mouth altogether. But we will typically have, if we're doing one arch, let's say, we're going to put you in some temporaries for 2 weeks to a month. We're going to make sure you're happy with it, and then we'll proceed for the next step. So it could be about 2 visits to get things done, as long as we're happy with the way things are going. So it could be about 2 months or so, possibly less, to get you from where you are to where you want to be. It depends if we're doing, again, 1 arch or 2 arches. Some people like to split things up. They'll do 1 at a time, depending on their comfort, see how long they want to like spend in the chair. If they want to have longer appointments or more appointments, or if they want to just have things in increments. Do you want to work on maybe 2 teeth today? Do you want to work on 6? Do you want to work on 10? It all varies on how quickly we're trying to get to the final result. Veneers typically last about 10 years or so with proper care and maintenance. You need to go to your checkup appointments, your cleanings, make sure everything is taken care of. You got to do your home care and make sure you're flossing, brushing, using your electric toothbrush, get a water pick, make sure everything's cleaned up. So whenever you come to see us, everything's clean and we don't have to possibly replace things. But sometimes the body is changing, things are changing, your body's always changing. The gum can sometimes recede, the bone can sometimes recede. So depending on you, whether you'd like to get things changed at a certain point, as long as things are still clean, it may or may not be necessary. Typically, whenever we do a veneer case, we like to recommend an occlusal guard or a night guard for our patients to sleep with, especially if they're nighttime grinders. We don't want you kind of going to sleep and maybe grinding your teeth if you had like a stressful day or something and you just start chipping things away. We don't want you to kind of like chew any like hard objects, nothing too crunchy with your front teeth. We don't want you grabbing things and trying to shear at them. You could either chip and damage the teeth, or you can possibly even have them come right off. Porcelain veneers won't stain like natural teeth do, but the composite ones can. Veneers should be cleaned like regular teeth. You're gonna wanna floss, then brush, and use some mouthwash, maybe use a water pick. Just make sure you're doing both the flossing and brushing at least twice a day. When it comes to cost of veneers, every case is gonna vary. Some teeth may need more work than others. Every individual tooth is kind of diagnosed on its own. We need to figure out what the tooth needs to get it to the aesthetic outcome and function that we're trying to get to. Some teeth have a little more gum than others that we would need to remove some gum. Some teeth have less gum. We might want to possibly add some gum to them. Every tooth is going to vary. You might need not just gum removal. If you have too much bone going on, you might need some actual clinical crown lengthening, or like the bone around the tooth might need to be raised as well. We kind of diagnose every tooth on its own. That's why you'll never get a certain price of how much a whole smile makeover would cost, because everything's always going to vary in every mouth. The cost can also vary geographically. Typically, veneers aren't covered by insurance. It's a cosmetic treatment more than it is a function treatment. They might cover crowns. That's when it's medically necessary. If there's caries, decay or a cavity that needs to be removed and there's not enough tooth structure left. So the insurance might cover your crown, but they're more than likely not going to cover your veneer. The most common thing holding patients back from getting their dental veneers done is post-operative sensitivity and just having tooth structure removed. That's why you should go in for an evaluation, see if the tooth removal is necessary, any enamel removal is actually necessary. The sensitivity can vary based on case. Some people naturally have more sensitive teeth than others. Just talk to your dentist, see if they have anything that they recommend you use prior to getting any of the treatments done that could help with that sensitivity. Patients should know that dental veneers are not an easy process to go through. It's not a very easy process to go through on the dentist side. There are a lot of things that go into this, and it's not a very easy thing to go through from the patient side. It's going to take a lot of patience. You are going to go through the whole process with us. It's like a team effort that we have to work together to get to the final goal of where we're trying to go. The best part of the veneer process is the completion. It's a life-changing outcome. You'll see a lot of patients come back at their 6-month appointment for their cleaning or their checkup, and they'll just be so much brighter, not just in their teeth, but you can see their whole soul kind of like glowing through their face. If you have any questions that I didn't go over in this video, feel free to reach out. I'll be happy to answer. Otherwise, thanks for watching this video.